Good morning for everyone. Thank you for coming today and join us on online session. And thank you for opportunity to share the latest news from SKO Congress, where European Wellness was invited for poster presentation together with our colleagues. This is a fruitful result of our common collaboration in framework of a memorandum of understanding between European Wellness and famous Ukrainian university like Bogomolets National Medical University and Institution Gerontology, as well as our collaboration with the Ukrainian Association of Osteoporosis. Let me remind that my all information from my lecture is intended for education purposes only. And I already introduced myself. I'm internal medicine doctor, cardiologist, and rheumatologist. So objectives of my lecture will be about the definition and relevance of osteoporosis, novel methods of diagnostic osteoporosis, and algorithm, prophylactic, and treatment of osteoporosis. And in end my lecture, I think you will be able to answer for all questions which I mentioned in my objectives. So osteoporosis is silent epidemic. Yesterday, I also explained that why it's silence, because no any specific signs of bone deterioration, and we can be aware about the presence of osteoporosis when first osteoporotic fracture has already occurred. So both men and women can be affected by osteoporosis, but of course, women are more commonly affected than men. What is the main aim of osteoporosis prophylactics, diagnostic, treatment? The aim is prevention of first fracture and cascade fracture, because wrist fracture double risk of vertebral fracture increasing 5 times hip fracture, and hip fracture double risk death. And despite of our awareness about the definition of osteoporosis, diagnostic, the osteoporosis is still a great social and economic burden around the world. And what is this bone aging? Let's dive inside, please, on the video. So bone is a living tissue, and we have many participants of this, many cells which involved in this process. But common renewal of bone tissue occurs every 7-10 years. Definition of osteoporosis is progressive bone disease characterized by bone loss, mass, and microarchitecture, which leads to the osteoporotic fracture. And up to 30 to 50% of women over 50 years has experience of osteoporosis fracture. There are two main types of bone distinguished, like cortical and trabecular bone. Let's dive inside trabecular bone. So we have two main participants of bone renewal. It's the osteoclasts, which resorb the bone, and osteoblasts, which rebuild the bone. They work all together. So due to our upright posture, our bone has some micro damage. And to heal this damage, the osteoclasts come to the place of these micro cracks, release the enzyme, and resorb the bone. After that, they call the bone builders, like osteoblasts. They attach of the place of bone resorption, rebuild the bone, and this is like the bone restoration occurs. So when this is activity of osteoclast bone resorption similar with bone formation, this is normal process of bone renewal. After this leads the rest phase or initial mineralization. First type of mineralization when very essential to have the normal consumption of calcium and vitamin D. After that, after first phase of mineralization, leads to the second phase of mineralization, when the organic components of bone, like type 1 collagen, should be coated by crystals hydroxyapatites. You can see on this video. And next, how the crystals of hydroxyapatite looks like. So during menopause or any other reason for osteoporosis development, the speed activity of osteoclast higher than activity of osteoblast. That is why bone resorption prevails over the bone formation and bone becomes very fragile. And of course, this bone can be more often we have some bone fracture because this is fragility of bone. So we have the three main phases of bone renewal, like bone resorption, bone formation, and mineralization. In normal bone remodeling process, osteoclast activity is similar with osteoblast activity. But in osteoporosis, we have the disproportion, high activity of osteoclast and low activity of osteoblast. And our normal bone becomes like this, osteoporotic. So in Congress SKO this year was emphasized that despite of our efforts, we still have gaps in undiagnostic case of osteoporotic bone. But how we can assess the risk of osteoporotic fracture? International Foundation of Osteoporosis offer for us some 1-minute test. So if we have even one positive answer, yes, so we have osteoporotic risk fracture. There are two main types of osteoporosis development, distinguished, like first type, it's age-related osteoporosis or postmenopausal, and second type, like secondary osteoporosis. For both of these types of osteoporosis, we have some common risk factors like smoking, alcohol consumption, caffeine consumption, more than 4 cups a day, low exercises, and deficiency of calcium, vitamin D, as well as dysbiosis. And if we are aware that our older population can be affected by bone fracture, but I today would like to focus on the diagnosis secondary osteoporosis, because secondary osteoporosis or second type of osteoporosis can develop due to some concomitant diseases like rheumatic disease, gastrointestinal diseases, blood disease, kidney disease, or due to taking some medicine like glucocorticoids, like thyroid hormones. Very important that as the some condition of thyroid glands as well as the thyroid hormones like replacement therapy can lead to the secondary osteoporosis. And if we talk about the osteoporosis like the some epidemic for elderly patient, but in case of secondary osteoporosis, this population can be also have a high risk of bone fracture in young age. And general, what the management of osteoporosis diagnostic after when you fill in this questionnaire with risk of osteoporotic fracture. This is gold standard like X-ray absorptiometry. And after this procedure, we receive some protocol with our bone mineral density results. For postmenopausal women and for elderly patients, this is T-score assessment. And T-score until -1 means the normal bone mineral density. This is mean that your bone mineral density compare with a normal health born 20 years old population. So deviation, that is mean the units in standard deviation. -1 means it's a normal bone mineral density. Between -1 and -2.5 is osteopenia or yellow field. And below -2.5 is osteoporosis. Bearing in mind that for young population without menopause and for men younger than 65 years, we need to assess bone mineral density by Z-score. And Z-score normal until -2. But X-ray examination, DEXA is X-ray examination. And now available new methodics like RAMS technology. It is a radiation-free technology. And European Wellness has this device. So how does RAMS work? So it's special radio frequency echo light multiply spectrometry, and that beam pass through the bone and do some spectral analysis, and finally we receive similar and familiar for us components of characteristic of bone mineral density like BMD and standard deviation, T-score for elderly and Z-score for young population, as well as a quantitative characteristic like fragility score. So this is looks the process of examination and protocol. The accuracy of RAMS technology results is comparable with the DEXA. And RAMS technology also has some special data like fragility score. It means it ranges from 0 to 100%. This is probability of bone fracture. And this recent SKO Congress was emphasized how important RAMS technology and it can provide safe and accessible alternative to DEXA of osteoporosis management, particularly in setting where DEXA is unavailable. But together with assessment of bone mineral density, it is very essential to know the future fracture risk. You should use the tools, FRAX, but after my lecture, you will have brilliant lecture of current president Ukrainian Osteoporosis Foundation, and she will explain more about some efficacy of this index and tools. But of course, we should calculate all together all reasons for bone fracture. This is also the reason for falling. For example, if patient has some dizziness problem or muscle weakness due to sarcopenia, of course, the falling risk will be higher and probability of receive the fracture risk also higher. So for Malaysia, we should use the Asia population, and for Malaysia available 3 variants like Malaysia Chinese, Malaysia Bumiputera, and Malaysia Indian. And as far as I mentioned about how important to check bone mineral density for young population with some concomitant diseases, that is why now FRAX available like FRAX Plus, which includes some questions of presence some somatic diseases to more precisely calculation of probability future fracture. All countries have their own guidelines management of osteoporosis, but this is roughly the similar, only reason difference between some medicine which improve or not improve is in some country. But what is the protocol? First of all, we need to assess the risk factors for osteoporosis and exclude cases of secondary osteoporosis. Of course, we need to advise the lifestyle modification and optimize the calcium and vitamin D consumption. And then, based on the results of some our devices or DEXA or RAMS technology, we need to know the bone mineral density or FRAX risk. And after that, all our clients, we can divide it to 3 category risk. And depends on what kind of category risk, we will have different ways for management these clients. So in case, if T-score up then minus 2.5, so up then red field, or FRAX risk, major risk fracture less than 20 and risk for hip fracture less than 3%, it means our clients in low category risk. What we can advise for them? We can repeat bone mineral density assessment every 2 years, or consider hormone replacement therapy for women for whom available this treatment. And then we need to follow up and explain patient about the lifestyle modification. In case if T-score less than minus 2.5, FRAC risk for major risk fracture more than 20% or hip fracture more than 3%, our patient in high risk category. For these clients, we have to advise based on the calcium and vitamin D. It's only basis, it's not specific treatment. Specific treatment in some osteoporotic medicines like bisphosphonates or monoclonal antibody like denosumab molecule. For very high risk patient means recent fracture while approved the osteoporotic therapy, multiply fracture, on treatment glucocorticoids, previous history of injuries, fall, high risk of falls, advanced age, frailty syndrome, or if very low T-score or very high FRAX risk, this is a very high category risk. Based on the calcium and vitamin D, consider the treatment of anabolic agent or alternative IV bisphosphonate. So I would like to talk about the secondary osteoporosis and how it can influence to our management way. So REMS technology for now accept as the most sensitive tools for assessment bone mineral density. Why? Because sometimes in case ossification, case osteophytes presence, or some vertebral deformities, or prosthesis, for example, or calcification of vessels, DEXA accept this bone like plus bone, so false normal. Can you see on this slide? So this is same assessment by DEXA and REMS technology. In DEXA, this is still level of osteopenia, but in REMS technology, because REMS technology cannot calculate this is false plus tissue. It's really very high risk patient. That is why for this patient we have to advise more serious treatment, despite of the after DEXA just only follow up and calcium and vitamin D supplementation. Another research have done some scientists, and it emphasizes the gaps between the DEXA and REMS technology in some cases. For example, in postmenopausal women with spinal osteoarthritis with osteophytes, REMS technology reveals osteoporotic cases in 35% versus DEXA only 9%. In those with a vertebral fracture, REMS reveal almost 60% of osteoporotic cases, and versus DEXA only 23%. Another very sensitive category patient for whom the REMS technology most sensitive, it's dialysis patient with a CKD. Because as I mentioned yesterday in my lecture, CKD is the reason for secondary hyperthyroidism, which leads to the vascular calcification. And REMS technology can overcome this calcification and give us the really condition of bone mineral density. Before this year, the changes in bone tissue due to some metabolic disorders in chronic kidney disease named as a renal osteodystrophy. But from this year in SKO Congress was separated this phenotype of CKD-associated osteoporosis because the bone deterioration in CKD patient not similar like age-related osteoporosis. And in fracture probability involves many characteristics, not only bone mineral density like the units of trabecules in 1 unit of volume. It's also very important to know quality of trabecules. That is why we advise you to do, if you have some DEXA device. For DEXA device, it's the trabecular bone score. This is the owner of this methodics. This is special program which applied on the dexitometry, DEXA, and can check the quality of trabecules of bone. In REMS technology, this is a fragility score. So both is adequate, but REMS more precise in case of osteophytes present in spine, calcification, and vertebral fracture. Another category very sensitive and beneficial REMS technology for them who undergoing hormone replace therapy after cancer. And next category, also very sensitive, it's a patient with type 2 diabetes. Usually, there's some correlation when we have the low mass, we have the high risk of osteoporosis. If we overweight, the bone tissue is higher, but it's not about the diabetes 2 types diabetes, because also the bone deterioration and bone becomes fragile in these clients not only due to bone mineral density, due to changes of quality trabecular bone. And last, a very sensitive category for whom REMS technology is beneficial is the pregnant women, because during pregnancy, women lost at least 4% of bone mineral density. And we cannot advise to check the bone mineral density for pregnant women because DEXA is X-ray radiation. But REMS technology available for this category, and we even can manage the bone deterioration or condition of bone during pregnancy, because in case of DEXA we can advise only once a year to check bone mineral density. But REMS technology is very safe and can manage this dynamic in 1 month, in 3 months, many times what we need. That is why the final session about the REMS technology underline how important to use and implement this technology in our life to check bone mineral density correct. That is why even not this year, in 2023, the SKO means the European Society of Clinical Economic Aspect of Osteoporosis and Osteoarthritis. There is some recommendation which emphasize how important and how accurate is this new technology, and can appear less influences by bone artifacts than DEXA in case of calcification, osteophytes, prosthesis, etc. Bearing in mind that in Malaysia, we have only 3 devices, 2 on Peninsula and 1 in Borneo Island in European Wellness. That is why we are looking forward for collaboration with our physician, our island and clinic to give the possibility for our clients to check in early stage bone condition and advise treatment, correct treatment in appropriate time. Very important that E. coli technology has registration in Malaysia, and also our doctors pass the training and receive the certificates. So prophylactic and treatment our patient. So I already mentioned about the 3 category risk, about the guidelines for Malaysia. So, and this is a list of medicine which can be used in different category risk patient. For example, in bisphosphonates, it's hormone replacement therapy, it's our anabolic medicine, but in Malaysia available only teriparatide, and our monoclonal antibodies like denosumab, rozasumumab. But bear in mind also, if we would like to decrease possibilities or fracture risk, we need to also taking into account some evidence base, because not all medicine has some results of trials for effectiveness prevention, for example, hip fracture in future. So of course, if lifestyle modification for our clients, we need to talk with them about the avoid some harmful habits like alcohol consumption, smoking. In case when it's acceptable, available for women in postmenopausal period, we heard today the report about it. This problem, our gynecologist Margarita Emelianova, and also need to mitigate the influence of oxidative stress, inflammation, and of course diet and physical activity. Diet with adequate calcium and vitamin D, but also physical activity. Particularly, it's a weight-bearing exercise. So if you would like to swim, and it's good for spine. But in case of if you would like to improve the bone mineral density, it should be weight-bearing exercises. Sufficient consumption of calcium-containing products, at least 1000 milligram daily, and if you're concerned about the kidney stone disease, the European Association of Urology underline also that should not restricted calcium. Even in some case, I tomorrow prepare for you some workshop, difficult cases in my practice, how we need to manage some patient with bone mineral density changes and with kidney stone disease. And fourth day, I will talk about general separate report about the all bioregenerative approaches for prevention of urolithiasis. But even urologists underline their daily requirement of calcium thousands or 1200 milligram. We need to maintain the level of vitamin D in appropriate level. And yesterday I explained what happened in a CKD patient. So our vitamin D, which we consume by supplements, food, isolation, cannot be connect with the vitamin D receptors. It should be transformed to the D hormone by 2-hydroxylation, one in liver and second in kidney by releasing the kidney alpha-1 hydroxylase. So if we have in clients GFR less than 60, means alpha hydroxylase cannot release in appropriate level. So we have the condition of secondary hyperthyroidism, which leads to the vascular calcification and kidney stones. That is why for these clients, we need to advise alpha-calcidol. This is an active metabolite of vitamin D. Also very important vitamin K2, but for nowadays, vitamin K2 not includes in our guidelines because a lack of some evidence-based. But many research confirms that the vitamin K2 help to conversion the glutamic to carboglutamic acid and deactivate osteocalcin, which induced conversion the endothelial this is cells of our vessels, to become like osteoblasts. And as I show in video that osteoblast want to capture calcium to deposit in bone, similar process occurs during the lack of vitamin K2. So these endotheliocytes can be converted to osteoblast-like and can active deposit calcium in vessels, soft tissue. So the effectiveness of menaquinol, or it's the similar like K2 name, is associated with a reduced risk of coronary heart disease in Rotterdam study. But did you know that bone senescence begin with a level of stem cells? For osteoblast and osteoblast, different mother or precursor. For osteoclast, it is the hemopoietic stem cells. For osteoblast, it is the mesenchymal stem cells. But due to multipotent characteristic of mesenchymal stem cells, then can be matured to the cartilage, bone cells, adipocytes, skeletal, smooth muscle cells, not only to osteoblast. And by influence some age-related factors like protein 2, ranks, osterix, they mesenchymal stem cells, they tend to shift not to osteoblast, to adipocytes. That is why we lost of bone and deposit the fat tissue. So the senescence begins with a cellular level, stem cells level. And many preclinical and clinical trials confirm the effectiveness of stem cells therapy, exosomes in part of bone healing after bone fracture, but not enough evidence in part of treatment osteoporosis. That is why still in convention medicine they are out of our guidelines. Another option, as I mentioned, this is exosomes. Exosomes is extracellular vesicles which carry biological active microRNA, proteins, lipids, so they act as some communicators between the cells. And also we have some evidence of preclinical research about the effectiveness prevention and treatment osteoporosis while we use the exosomes. So I'm very happy that European Wellness hosting this international conference alongside with our colleagues from Ukraine. And we have really fruitful results of our collaboration because we have published already Scopus journal articles. Our common results of our common work was accepted not only this year and previous SKO Congress 2023, 2024, and I mentioned this year Congress. We also have published our book, common book, Longevity for Heart, and we are on the way. They published the new our publication, Common like Osteoarthritis, Common Approaches by Regenerative and Convention Medicine Approaches. In conclusion, so we were about the silent epidemic of like osteoporosis still remains a big the social and economic burden around the world. And you know that they're very important to early diagnostic and most important timely initiation of correct treatment. And also REMS technology available and most sensitive in some cases because it can overcome some artifacts which DEXA accept as a normal tissue. And European Wellness currently only one clinic in Borneo Island which has this device, and we open to future collaboration with our physicians. And I would like to honor memories of my teacher, Professor Povoroznuk Vladislav. He is the first president of Ukrainian Osteoporosis Foundation, and he always mentioned the quotation of Lao Tzu that the journey of 1,000 miles begin with a single step. So what will be our next step? Of course, confidence. Thank you for your attention.